Hi, my name is Daniela Lauri and I am going to talk about the evaluation of diabetes in self-management of the program in different countries. Definition: Diabetes is one of the most common chronic diseases worldwide. It's a globally epidemic metabolic disorder with a global prevalence of 8.4% with the highest levels at 9.2% reported in the Middle East region. This high prevalence is expected to continue rising in the future. The education of diabetes patients to manage their illness and adopt lifestyle practices to prevent complications is widely recommended, particularly in populations where economic resources are limited. We can call it diabetes self-management education.
Have you or a family member been diagnosed with diabetes? Do you feel overwhelmed by the information you received about how to manage your diabetes? Good news! There is a
There is a
valuable
valuable
resource
resource
available to
available to
help
help
you
you take care of your diabetes. Diabetes Self Management Education is a program where you will get customized one on one training from a diabetes educator. A diabetes educator is a specially trained individual who understands what you are going through and can help you make a plan and put the skills you learn into practice. You also get group support from others who have diabetes. This program will help you learn the skills needed to manage your diabetes and thrive in your life. And as an added bonus, diabetes self-management education is covered by most insurances. Ask your doctor for a referral to Diabetes Self-Management Education today, or visit livingwell.utah.gov to find a diabetes self-management education program near you.
Applications in nutrition. Diabetes is a chronic disease that requires a person with diabetes to make a multitude of daily self-management decisions and to perform complex care activities. Diabetes self-management education provides the foundation to help people with diabetes to navigate these decisions and activities, and it has been shown to improve health outcomes. Diabetes self-management education is the process of facilitating the knowledge, skill, and ability necessary for diabetes self-care. The overall objectives of DSME are to support informed decision-making, self-care behaviors, problem-solving, and active collaboration with the healthcare team, and to improve clinical outcomes, health status, and quality of life.
Hi, I'm Joan London. Managing diabetes can be complicated, even confusing, especially when you're first diagnosed. Working with a certified diabetes educator is really the best way to get the support that you need. Joining us is Christina Macchio, a certified diabetes educator, and Dr. Ann Albright, director of the CDC's Division of Diabetes Translation. Ann, it just seems like it must be kind of overwhelming to a person to first get that diagnosis because you really do have to learn to manage it, right?
It's critical. It's like buying a new device, and you need to have some instructions. Otherwise, you're flying in the dark. So getting diabetes self-management education and support is at the heart of good care.
So how do you go about working with patients?
So my goal with patients is to meet them where they are. I learned that very young when I started working in a public hospital. I had 70-year-olds, I had 30-year-olds, I had people of all ages in one room. Some people didn't speak English. So I had to speak food because that was a common language that everyone could get, and I used a lot of visuals. And from there, I really developed an approach to make people start feeling comfortable with this thing that they didn't ask for, but that they felt in better control of after a certain number of classes and workshops with me.
Are you also there to say, yeah, we're going to figure out how to manage this, but you're still going to be able to live your life okay?
Absolutely, you're still a person. You're now a person with diabetes. Diabetes is not who you are.
All right, so this is like kind of the human touch, right? That's so important.
Yes, diabetes is very personal. There are millions of people in the country with diabetes and pre-diabetes, but each with diabetes has to find their journey, and to be as successful as possible in diabetes self-management education is critical to having an enjoyable and full journey with diabetes.
All right, well, I thank you both. So if you want to get more information on diabetes self-management education and find an educator like Christina, log on to cdc.gov/diabetes TV. We'll see you next time. I'm Joan London.
Sponsored by NACDD with support from the Centers for Disease Control and Prevention. Visit cdc.gov/diabetes TV.
Pros and cons. Pros. DMSE has been shown to be cost-effective by reducing hospital admissions and readmissions. Is reported to reduce the onset and/or advancement of diabetes complications and to improve quality of life. Also to improve lifestyle behaviors such as having a more healthful eating pattern and engaging in regular physical activity. Cons. DSME programs have limited benefits to improve some behaviors, especially smoking cessation and food care.
Well, a diabetic certainly can do well on their own to manage their blood sugars with the help of their physician and the many resources that are out there. I feel it's helpful for them to go through a diabetes self-management education program because you can learn a lot more information about other topics that you may not get from the internet or from books that you buy. Topics such as how to best manage when you're traveling and you're off schedule, how to manage when you're under stress, if you're sick. There are a lot of considerations there to keep yourself safe and to prevent extremely high or low blood sugars. Certainly for many diabetics, they will learn from the other individuals in the classes that they attend when they go through one of those programs, and get support and understanding that other people are dealing with the same type of issues they are. So it's beneficial from that standpoint. Certainly for fine-tuning the diet and being aware of the changes that can take place over time. Diabetes is considered a progressive condition or disorder, meaning that the body may over time produce less and less insulin, become more and more resistant to the insulin the person makes, and there may need to be changes in the treatment plan. And if a person goes through an entire series of classes, they're much better prepared and aware and looking out for these changes so that they can get help from their physician and change their treatment plan to stay in good control as needed.
Issue applied in Ecuador. In Ecuador, the reported cases for diabetes were adults between 20 and 79 years. However, the number is much higher because more than a half of the people who suffer from it doesn't know it. According to some data, in Ecuador there are around 500,000 people who suffer from diabetes, but only about 100,000 receive adequate treatment. conclusion, DSM-E programs are highly effective to improve glycemic control, lipid profile, and BMI, while mostly effective to improve BP. Also, they can reduce the risk of developing diabetes complications. Patient diabetes knowledge, DSM behaviors, adherence to medications, self-efficacy, and quality of life also can be significantly improved by DSM-E. Diabetes education provides the knowledge and skills to optimize self-management, but more importantly induces a positive attitude towards patients' active participation in the control and treatment of their disease.
Well, always take your medication like your doctor says. Always maintain the healthy, the healthy food choices. Be prepared for anything, especially, nowadays with so many natural disasters happening. You need to keep some extra medications on hand. You need to keep a list of your medications, in case you can't communicate with someone. Keep extra clothing, and, just take care of yourself. And when you go to your doctor, make sure you take all your medications, especially if you see other physicians for other conditions and stuff, because that way all the doctors are on the same page as you are, and they know what's going on with you. But it's usually just a matter of fact of just taking care of yourself, making sure you've got everything that you need, your meds, your syringes, an extra glucometer if you can, if you can afford it, and just take care of yourself.
Thank you.